Welcome to Between Bites Piecemeal episode. Piecemeal is a podcast hosted by the Emily Program, and Between Bites are short episodes addressing topics you want to know more about. Piecemeal covers topics related to eating disorders, body image, and how society may influence our thinking. Please use your discretion when listening and reach out for support as needed. I'm your host, Jillian Lampert, and for Between Bites, you get just me. So, welcome to this brief little conversation. Today's topic is all about an eating disorder called ARFID. It stands for Avoidant Restrictive Food Intake Disorder, and it's often described as extreme picky eating. What is it really all about? Today, we're going to talk through it. So, what is ARFID? ARFID is defined by a pattern of eating that is limited and associated with really important medical and psychological consequences. So, typically, ARFID impacts somebody's eating by leading them to eat a limited volume or a limited variety of food. It can lead to serious medical consequences, weight loss, growth deceleration, which basically means somebody, particularly a young person, is not growing adequately, can lead to nutritional deficiencies, and it can lead to a dependence even on tube feedings or supplements to get enough nutrition. Also, really importantly, it can lead to significant psychosocial impairment, which means that somebody's day-to-day living is impacted, particularly their interactions with other people and social situations. So if a person can't eat in social situations or eat outside of these very narrow parameters, that can result in social stigma, in anxiety, in isolation, in addition to the potential medical consequences. So somebody with ARFID or maybe their parent presents with usually some pretty we see some common things for folks that are struggling with ARFID. We see sometimes difficulty approaching certain foods, a real limitation in the numbers of foods that somebody will eat. That's that lack of variety. We see folks avoiding certain colors or textures of food. Perhaps they're eating only very small portions. They might not have an appetite. They may be afraid to eat. There's sort of this fear with eating, especially if it's been after a frightening episode, like choking on something or vomiting after eating something. And sometimes folks are uncomfortable eating in public or with other people in other social situations, particularly when the social situation is such that they can't get the food that they're comfortable with. And so it feels very concerning to them. ARFID has sort of three different ways that it can present, and interestingly, some folks can have more than one, so it can be a mix of all three, but there are three kind of ways it presents. There's a restrictive way, an aversive way, and an avoidant way. So let me walk you through what that means. So restrictive would be like sometimes people are just not hungry. They're not interested in food. Their sort of internal cues for hunger and go seek some food are just pretty quiet. And so they're not really that interested in food, particularly if they're involved in something else. If they're focused on something else, they're just not that interested in food. And they sort of sometimes, forget to eat, quote unquote, or forget that they need to eat. We see this sometimes with folks that also have ADHD, where they just are not as interested in food, and food is not at the top of the list of interesting things to focus on. And so time goes on without them having adequate nourishment. The aversive kind of type is really a fear type of ARFID. It's being fearful of food or eating because of an experience with choking or vomiting, which makes some sense, right? If you had a really, really fearful, traumatic episode with eating something, you're probably unlikely to want to eat that thing again. And it also very likely might extend to other things, other foods, just to have that fear of eating because you're afraid of choking again or you're afraid of vomiting again. And then the avoidant version is really, kind of has a hallmark of disgust, which is one of our emotions that sort of lives in our amygdala, that tells us, tries to keep us safe from approaching things that are disgusting or that are difficult or that will be repulsive. And so, in the avoidant version, sometimes disgust is very heightened for people. So there's disgust with eating certain things. There can also be a sensory sensitivity to different aspects of food, like taste or texture or smell or temperature or flavor. And so the avoidant is either sort of a disgust experience or a really difficult sensory experience. Like it just doesn't feel okay when I touch it or when I put it in my mouth or when I smell it or when I feel the temperature. And so I just don't want to eat it. I want to avoid it. So restrictive, sort of not interested, not hungry, not approaching. Aversive, not wanting to eat because of fearful of consequences of eating, with choking or vomiting, and then avoidant, which is really hallmarked by that disgust or sensitivity. And again, like I said, some people can have a mixture of each of those or a couple of those together. But we really want to understand when we're talking with somebody who might be struggling with ARFID, which of those aspects are important to them, which of those did they experience. So let's spend a couple minutes on what does treatment look like for ARFID and how is it different than other treatment for other eating disorders? People often ask me that, like, how is ARFID treatment different than treatment for anorexia nervosa or bulimia nervosa or binge eating disorder or other eating disorders? And treatment looks similar in a lot of ways, in some of the same ways we care for people with other eating disorders. But because the person's concerns aren't centered around body weight and shape concerns, or concerns about the impact of food on their weight, but rather concerns of how difficult it is to approach food for other reasons. The treatment for ARFID doesn't include the same kinds of body image focused interventions in that same way, or discuss fear of eating because of weight gain and impact on body, but much more, it approaches the fear of eating because of the experience of eating itself. The things that are really similar are that we want to achieve and maintain a healthy nutritional state. We want people to be able to correct any nutritional deficiencies they might have. We do want people to be able to expand the variety of foods that they can eat so that they really can be eating in some of those social situations and different opportunities in their life to engage with other folks around eating. So we do want to expand the variety of foods eaten. In addition, that helps to ensure an adequate amount of nutrition is consumed. We want to help folks develop healthy coping skills to identify their emotions, to manage their emotions and their experience, and to manage the fancy word for it is interoceptive. Interoceptive means how do I hear my body's experience in my brain? How does my brain know what's happening with all of my sensory perception ways that I perceive the world? How is my body experiencing that? And what does the brain tell me to do next based on that? If something is frightening, I think it's frightening, my brain is going to say, push away, don't do that frightening thing. If I'm disgusted by a flavor or a smell or a taste, my brain is going to say, don't eat that. That seems bad. And so we're really helping people to manage their interoceptive awareness and experience of helping sort of calm perhaps an overly heightened sense of some of these experiences. And we also want to make sure that people have increased comfort in social situations. So whether it's a child with ARFID who is, 3, 4, 5, 6, 7, 8, 9, 10 years old, who is really kind of unable to like go to the birthday parties with other friends or start to go to sleepovers when they're old enough or eat with other people. We really want them to be able to do those things. Those are developmentally appropriate things to do. And so we really want people to be able to experience food in a way that allows them to have those socially typical experiences. And then the other cohort of folks we see struggling with ARFID often is folks who are maybe 18, 19, 20, 21, 22, that sort of young adult period of life, because the way that ARFID is impacting their life is similar to the younger kids, but different than those experiences that young kids are having. But they share some of the same qualities. Like if somebody's going to college, they want to be able to eat in a residence hall setting. They want to be able to eat with their friends. They want to be able to go out and be in those social situations that are really such an integral part of college without having to have fear of eating hold them back and end up resulting in that isolation. And particularly in those situations that are a lot about transition and a new way of living and being in the world when you go to college or when you move out of a family home, to really be able to have comfort in those new situations. So lots of times we'll see folks coming in with younger kids or with young adults when there's a transition or an age transition, that means that things will be different around food. Important question. Can people get better from ARFID? Yes, absolutely. With adequate treatment, people can expand their food intake. They can decrease their discomfort with eating. They can decrease their fear with eating. They can have solid strategies to approach new foods and new eating situations. They can manage their experience with eating and their emotions around eating, and that allows them to have an improved nutritional status and improved social experiences. So we definitely know that people can recover from ARFID and get a lot of strategies to make, even if they have some ongoing continued sensitivities and experiences with food, just because of the way their brain is wired, that's okay. Having some really solid tools on how to deal with that is really, really helpful. So I always tell people, just like every other eating disorder, don't wait. Help is out there, help is available. Let somebody know you're struggling and get some help. So all of that in a nutshell, I hope that makes ARFID a little more understandable. If you or someone you know is struggling with ARFID, please reach out for help. Don't wait. Like I just said, don't wait, because the longer you wait, the more you suffer. And the earlier you reach out, as sometimes overwhelming and challenging and difficult and trying as treatment can be, it's the bridge to get you across to wellness. And the longer it takes you to approach the bridge, the longer it'll take before you can get to the other side. So don't wait. If you're a parent, call for help. If you're an adult, pick up the phone, go online, fill out a form. It's really easy to just reach out uh, in terms of that one action. I know it's not really easy to make the decision or to pick up the phone or to type in your name and phone number. That is difficult for people who are struggling with an eating disorder often, because it's scary. And family program and everybody else who cares for people with eating disorders is going to do everything we can to help make that. Once you take that really scary step, we're going to be there to help you. So let us know. Let somebody know. Please reach out. And if you have a topic that you'd like to see discussed on a Between Bites episode, drop us a line and let us know. If you've enjoyed today's episode of Piecemeal, please subscribe, rate, or leave us a review on Apple Podcasts or wherever you listen. Learn more about us at emilyprogram.com or find the Emily Program on social media. Piecemeal is produced by the amazing podcast team at the Emily Program. Until next time, take care. Thanks for listening.